So while we're waiting for the poll for folks to be able to finish accessing the poll, I'd like to introduce myself and our panelists and co-hosts. My name is Brenda Shurman, and I am a professor at Texas State University. I also am a partner with the National Technical Assistance Center. My role with the center is that I work with alternative education and juvenile justice programs, supporting programs that are exploring PBIS or actively implementing PBIS. Our panelists today are two really experienced and knowledgeable women that work with very knowledgeable about PBIS and that work with and are knowledgeable about alternative school settings. Kim Wood is with Placer County Department of Education, and Sherry Daisy is with, Sherry, I'm going to let you introduce yourself. I think you're with the University of Nevada College of Education, is that correct?
Correct, and I work for the PBIS Technical Assistance Center, which is housed within the Nevada Center for Excellence in Disabilities within the College of Ed.
Okay, see, you did that so much better than I could have.
Yeah.
And my two co-hosts today are Jeff Sprague. Jeff is a partner with me at the National Center. He also works with alternative education and juvenile justice programs. And Mike Turner. Mike Turner works with me on PBIS in juvenile justice projects and has recently left a very long career with the Texas Juvenile Justice Department, where he oversaw the first implementation of PBIS really in the country in juvenile justice programs. Okay, I am going to end our poll and let's see the results. So there we go. Looks like Alternative Day School represents most of our participants today. Okay, well, I don't want to take any more time, so I'm going to turn it over to Kim and Sherry. I'll be here if you have any questions during their presentation. Just put them in the chat, and I will we'll have time at the end, and I will also interrupt if there's something pressing that we need to address sooner. Okay, Kim?
Okay, awesome. Thank you. Welcome, everybody. I'm really glad that you all participated in that poll too, because that helps us adjust kind of the focus and what we're going to be talking about today. So that's fantastic. Really today, what we want to focus on is digging a little bit deeper into different types of data that we can use in alternative or juvenile justice programs. So we're going to be focusing on outcome data, survey data, and Fidelity data. And we really want participants to have a good understanding of the rationale of why it's important to kind of use all of those. Today's webinar also is going to be a little bit different because we are going to have you practice working on your own types of data, maybe scaling up data that you already have or creating a new data source. So we are going to have, just be warned, we are going to have a little practice session. So Sherry and I are going to take you through kind of a, I do, we do, you do kind of model where we'll give you a lot of examples. We'll talk about it. We'll model one together, and then we're going to give you just a couple of minutes and say, okay, now use this document and work on this, and then come back and talk about it. So hopefully we'll have most of you guys participating in that as well. Okay, Sherry, you want to talk us through these procedures?
Absolutely. So I already actually noticed someone has hopped into the Google Drive and made a copy. So that's something that we're going to chat with you about. We want to give you these materials, but we want you to download them because if you make a copy in our drive when we're done with the training, we're going to delete it, and that's not going to be really helpful for you. So let me go ahead and share my screen, and I'm going to show them the Google Drive with the materials for them. All right, thank you, Kim. So I'm not sure everybody's level of experience in using a Google Drive. So I just want to share with you here that we have several documents uploaded as PDFs. All of the PDF files here, we have the slideshow, we have an article, examples that we're going to share with you, the facility-wide TFI, all of those can be downloaded by right-clicking on the file and then going ahead and downloading a copy onto your computer. So that's what we really want you to do. We want you to download it to your computer. The one file that you're going to need when we do the guided practice is this PBIS data and alternative settings planning document. That also, if you are in the Google Drive right now, I would suggest that you download it onto your own computer so you have that when we get to that point. And again, you do that by right-clicking and clicking download. If you're not really great with right-clicking, which some people aren't, then you can double-click on these files. And then what you would do is go, why is it not showing me that? Oh, go to these three little dots here and click download. All right. And that is the same for the planning document. If you double-click on that, then you will go to File, and you will download. So I said download many, many times. And the reason is it's really important. It'll make everybody's lives a lot easier. So please do that. Kim, you can go ahead and start sharing again. Great. As far as our Zoom procedures, for that, we're going to ask you to put general comments and questions in the chat. And Brenda and the other co-hosts are going to manage the chat box, but we will hopefully have time for a question and answer session at the end of the webinar. So I believe that's everything I wanted to talk about. If you have any questions about how to use the Google Drive, please put those in the chat and I can assist you while Kim goes on with the presentation.
Awesome. Thank you, Sherry. And I noticed there's a few copied documents in there already for folks that had actually accidentally done that instead of downloading it. And so Sherry, maybe you can hop in there super quick and take those copied ones out. That would be fantastic. So, okay, great. All right. Whoops. Here we go. All right. So today, before we jump into everything, just a couple of disclaimers and things that we wanted to hit right up front. So the terminology today, we kind of designed this to talk about a variety of different alternative programs that could include either juvenile justice facilities or alternative community day schools, residential facilities, mental health facilities. And so the terminology really changes across those. Sometimes they're, the people that we're serving are referred to as students. Sometimes they're referred to as youth. Sometimes they're referred to as patients. So what we're going to try to do today is just use an umbrella term of individuals. So when we're talking about individuals, we're talking about any of the people that you're serving in your programs. I will give the disclaimer that I will often default to students. So I might be saying students, but just so that you know, that's what we're trying to do there. Also, we're really focusing on tier 1 data today. So everything that we're talking about is to address system-wide issues and address the systems and practices that we're doing for everybody that we're serving. So we're not really going to be digging into tier 2 data or tier 3 data at this point in time. Also, making the distinction here of formative versus summative assessment. Both are extremely important. Summative assessment is usually, the overall summaries that we do about how our program is doing at a fixed period of time or based off of different benchmarks or different goals. And so that might be reported annually or, quarterly or whatever. Today, we're really focusing on the formative assessment. So using data on an ongoing living way, hopefully in our monthly PBIS meetings, so that we can see live data, make decisions in the moment, come back the next month and see if it's working. So we're really focusing on that smaller vision of data and how to use data. But that being said, we definitely need both of those. We need both formative and summative assessment. Sherry just went over the Google Drive. You'll notice in this PowerPoint or in this PDF of the PowerPoint that there are hyperlinks that should take you to all of the documents that you'll need kind of, or resources that are peppered throughout the PDF as well. And a tool that we're going to be linking a lot of our content to today is the facility-wide tiered Fidelity inventory. So we want to make sure that everybody is really up to speed about that. And I'm going to ask Brenda to jump in and give a little update and overview of the TFI.
Good. Thank you. Well, I'm very excited to announce that the TFI, the Facility-Wide Tiered Fidelity Inventory, has been updated, and version 0.2 is now available for download from the PBIS Center. And Sherry and Kim have a link, have the TFI version 0.2 on the Google Drive, and I'll also put a link to the PBIS Center location where you can download it. There's also an accompanying technical brief that tells the process of developing and validating the content of the TFI version 0.2. And there are changes from the first version. So I would encourage you to gradually make the shift from version 0.1 to 0.2 as you start doing your fidelity assessments, however often you do those. Okay, thanks, Kim.
Okay, awesome. And I just wanted to highlight another one of the resources it's on the resources and references page too, but that an article that Brenda and her colleagues wrote in 2015. And some of the highlights from that article are woven into the content today as well. So that's a really good resource for you to check out in whatever kind of alternative program you're in as well. Okay. So overarching concepts here is, I kind of think about it as a tripod, where you need all three legs to really have robust data measures for whatever kind of alternative court and community program that you have. And that's to look at having different types of measures that include outcome measures. So what's happening with the individuals that we're serving? What metrics do we need to know for our program if the people that we're serving are making the progress that we want them to make across all domains, academically, behaviorally, social, emotionally, and really making sure that for every different context of a program, we're selecting the metrics that are going to be most relevant for our context. And again, using it in that formative assessment way so that we know if we need to make system-wide changes to our practices. So in addition to outcome measures, also making sure that we have ongoing measures for fidelity, and that includes fidelity of PBIS as a whole. We'll give a lot of different examples about that. Fidelity of different systems that we're doing, but the question is, at a very base level, are we implementing things the way that we are intending them to be implemented, and as they're written and intended to be? So, and then the third leg of that stool, if you will, is survey data. And that's looking at all of our stakeholders, whether it's families or community partners, community funding sources, students, staff, individuals that we're serving. How are we measuring not only their satisfaction with the program, but whether what we're doing is valid for their needs and their goals and desires, and whether they're pleased with the outcomes that they're getting. And then also, surveying about how is our program, specifically our PBIS program, working for them. When we get that information too, all of these three sources of information give us different angles of understanding what we might need to change or adapt so that we can meet the outcomes that we're hoping to meet. Examples in these areas, these are obviously, this isn't an exhaustive list. To back up a little bit, as Brenda mentioned, I'm a behavior analyst for Placer County Office of Education. We have alternative programs. I serve our court and community programs as a behavior analyst and a PBIS coach. So the examples that we'll be talking today apply to court programs. We have some community school programs in there. So you'll see a variety of different things. So just also that little disclaimer there. Outcome data, just some examples might include behavior referrals. That's a very common type of outcome data that we collect in PBIS programs. What are the majors, what are the minors, so on and so forth. In our more alternative programs, some other examples might be, what are safety and security violations? What's resulting in hands-on, or what are precursors to safety and security violations? That might be an important piece of outcome data to collect. Looking at attendance or program participation, positive or pro-social behaviors. We'll get into some examples about that, but looking at what are the people that we're serving doing well, how often are they getting acknowledged for that? That's a really rich data source too, to make decisions and to also make sure that our staff are focused on positive social behaviors as well. We'll talk a little bit about disaggregated data by individual groups. So looking at, for example, behavior referrals or accomplishments and seeing if there's any discrepancy across groups of whether it's race, ethnicity, special ed status, so on and so forth. Another piece of outcome data might be recidivism. How often, if it's a locked correctional facility, how often are we having individuals return to us? Or even if it's like one of our community schools is for expelled youth, how often are our youth returning to less restrictive environments? So you can see that it goes beyond just behavioral referral data as different types of outcome data that might be important for your program. I discussed some of the Fidelity examples. We'll get into these, but looking at Fidelity in terms of core features of PBIS, using a walkthrough tool, which is part of the facility-wide TFI as well. It might be looking at the fidelity of implementation of just one little piece of our PBIS implementation. So what's the fidelity of recording behavior data accurately? Or what's the fidelity of teaching expectations on a set schedule, so on and so forth. So again, it's a matter of your team saying, what do we need to know as far as, are we doing how things the way that they were written or intended? And then survey data examples might be looking at the safety of the facility or the school, or the climate. How do people feel about the positive nature of it? The social validity of elements, how, like I said before, how are the data systems working, so on and so forth. And looking at surveying all of your stakeholders, surveying your families, surveying your students, surveying your staff, and combining that information even to see, okay, what are the trends across all of the people that we're serving. So these are some of the examples that we will be talking about today. This pattern here, if some of you have attended some of our other talks, you'll see that this is a theme of always making sure that we're going through the database decision-making process of, here's what, looking at our data, so what does it mean to us? Is it a problem? Is it something that needs to be addressed? And then now what action are we going to take? And then come back and start the cycle over again. Did that action work? Did we get the change that we wanted? And this process really is what makes PBIS come alive in every setting, whether it's a general ed setting or alternative ed setting or juvenile justice facility. Looking at this process being the backbone of every single PBIS meeting. So working this into your monthly meetings, using that formative data and looking at it from a tier 1 system. So that one thing to think about with your teams when you're having your facility-wide or school-wide meetings at tier 1 is making sure that there is a time and place to just look at program-wide data and resist the urge to start talking about specific individuals if they're cropping up in the data. Save that for an intervention meeting. Make sure that we're really staying focused on, okay, what's happening as a whole? What do we need to change as far as systems and practices? And keeping different separate spaces in your meetings to talk about system-wide versus targeted intervention. Today, you'll see in some of our examples, and as we walk you through it, we've tried to align some of the items in the facility-wide TFI with these 3 data types, with survey outcome and fidelity types. And this is how we classified it. So item 1.10 in the facility-wide TFI, for example, talks about staff involvement, and that's getting staff feedback and sharing information with them. And so we put that in the survey category. In the outcome section, we'll talk a little bit about the positive youth acknowledgement and using even that as outcome data. That goes along with 1.8. And then there's items for discipline data, and then using data for database decision making. So you'll see those woven into some of our examples and some of the work that you'll be doing too. And then item 1.15 to talk about Fidelity data. So that's the general alignment there. I mentioned the article that Brenda and her colleagues had put out. These were some core features in there that they outlined that we've also woven into these 3 data categories today. So the way to really make your data work for you so that you can get the outcomes that you want through your PBIS program is planning out your data systems and addressing each one of these areas. So how are we going to, address the efficiency of the data, the relevancy, the timeliness, and the accuracy? And for alternative programs, there do need to be some unique considerations in these areas, because whether it's a juvenile justice facility or a community day program, we often have more individuals coming in and out, or a mental health institution. So these are intentionally outlined for you to really help make sure that you're planning and strengthening your current data systems so that they address these elements. And we'll walk you through those. All right. Sherry.
Thank you, Kim, for doing that overview. So now we're going to dive into each of those categories that Kim mentioned. And the first one that I'm going to share some examples with you for are outcome data. So Kim mentioned there's so many pieces of data that we collect in alternative settings that we can use to measure our outcomes, including referrals for problem behavior, if there are safety and security violations, data regarding participation and attendance in programming, the demonstration of positive pro-social behaviors. We can also disaggregate our data by groups to look at disproportionality. Most importantly, in many ways, looking at recidivism data and return to less restrictive placements is a really important source of outcome data. And when we look at these different examples, we're always asking we're asking ourselves, are we meeting our objectives for the majority of the individuals in our program, because we are talking about tier 1 data systems today. And therefore, using that data, do we need to modify or adjust our systems and practices to be more successful in serving the individuals that we work with? You want to? Thank you, Kim. So when you look at the Google Drive, we have a document that's titled, it's a PDF, and it's PBIS data and alternative settings planning examples. So all of these examples are in that document, and we have gone through the data source, whether it's outcomes, survey, or Fidelity, and then looking at those 4 questions. So the first example I'm going to share with you when we're looking at planning for effective data in alternative settings is the use of a web-based platform called Swiss. And we're going to be looking at minor and major discipline referrals in using this example. Swiss was originally developed for schools who are implementing PBIS. It stands for School-Wide Information System. But Kim and myself, and I'm sure there are other people out there in this work who have learned how to modify it for use in alternative settings. It was fairly easy to be able to adapt it so that we could collect data in our different settings using this web-based platform, which does cost a subscription fee, but it's not too expensive, and we find it to be very beneficial. So the question we're asking when we're looking at minor and major discipline referrals, if you look in that left-hand column, is if we have patterns of behavior occurring across individuals or contexts that we can address using our PBIS systems and practices. So the first question is about efficiency. How are we going to store our data, gather it, input it, and so on? So in this example, staff complete a paper behavior referral form when problem behavior occurs, and then those paper forms are given to the graveyard staff who enter them into the Swiss platform. It's all drop-down menus. It's very user-friendly, easy to do. The data is then stored on the platform and accessed in that way. And when the data analyst wants to bring the data reports to the team at their meetings, they can generate those reports very quickly. For relevancy, the use of Swiss really allows the team to look at these specific contextual factors like time and location, type of problem behavior, perceived motivation, others involved. And then we can look at those features and see if we can make proactive measures to reduce the occurrence of the problem behavior, teach alternative behaviors, and so on. Additionally, Swiss allows us to look at disproportionality across groups, which Kim mentioned, gender, race, IEP status, and so on. In terms of timeliness, Swiss really allows for instantaneous access as soon as the data is entered. The data analyst would just merely select the dates for the reporting time frame that they're interested in, select the contextual features that they're interested in, the variables, and then can generate those reports. And typically we find in our work that this can happen within 24 to 48 hours because of the delay of the graveyard staff entering the referrals. When we look at accuracy, the enrollment needs to be updated on a set schedule because oftentimes in alternative settings, our population is changing rapidly. So in this example, it's updated on a monthly basis, the first day of the month. And then we also need to look at calculations in terms of average daily population, total monthly care days, and so on. With all of these data examples, we want to do data integrity checks. It's very, very important that the data we're entering is actually accurate, right? Especially if we're going to use it for database decision making. And we have to have staff training in place in terms of both collecting the data, entering the data. These are some graphs that are generated in Swiss just to give you a visual of the data reports that can be utilized. So in this graph, we have referrals by problem behavior. You can see that our highest incidence of problem behavior is in the minor defiance category. In Swiss, that capital M stands for minor rather than a major. So we can look at this and say, wow, okay, we better target minor defiance, out of bounds, and minor disruption because those are our highest frequency problem behaviors. So what alternative responses can we teach? So you can see how the use of these graphs immediately lead into some really good database decision making. Can you show the next one, Kim? When you look at this one, we're looking at defiance by day of the week. And I'm assuming that when you see this, your first question is, what the heck is going on Thursday, right? We have this big increase in problem behavior. It's a really nice visual representation that allows us to identify and question what is going on Thursday that we can intervene on and hopefully make some improvements. This one is referrals by time of day. And I'm hoping that when you see this, you're thinking, well, something's going on about 7 a.m. every day, and something's going on about 5 p.m. So this allows us to really target those specific timeframes and do an analysis so that we can address those higher incidences of problem behavior. I think this is the final Swiss graph we're sharing, and this is defiance, and this is number of referrals per student. So when you look at this, the bottom axis there, those are all the student identification numbers or individual or youth or whatever terminology you're going to use. They're their ID numbers. And so we can see that we've got that student on the right with 10 referrals, and then another one with 8, and then we've got 3 with 6. And we might have some database decision rules where we're like, if someone's getting 6 or more referrals, then we're gonna look at increased tier supports, right? And we're gonna really dive into that, and that becomes more than a tier 1 intervention. But these are just some examples of graphs that Swiss generates. So what we want you to do now, or what I would like you to do now, is consider the information I just shared and thinking about the facility-wide TFI 1.13 item, which is discipline data. How would you score this example? And you can go ahead and put that into the chat box. Would it be a 0 where no centralized data system exists? Is it a 1 where it exists? but we don't have a full set of graph reports? Or is it a 2 where it exists and the team has ready access on all of these different variables in terms of behavior? So how would you score this item if you were using this data system? Great, thank you. I'm seeing lots of 2s. I think I saw a 1 in there, but lots of 2s. Okay, yeah, Kim and I would agree. When we went through this, we scored this as a 2, this example, because it does allow for ready access. The visual reports are with a click of a button, essentially, and we can not only look at the facility-wide TFI talks about location, time of day, and youth, but Swiss actually collects even more additional information on others involved and perceived motivation and day of the week and problem behavior. So yes, we would score this example as a 2. All right, and now I'm going to share our second example for the same type of outcome data, which is minor and major discipline referrals. And we're guessing that the use of an Excel spreadsheet is actually probably more common in alternative settings than Swiss, because Swiss was prepared with schools in mind. A lot of people think that they can't use it, and so they tend to utilize Excel. So we do think this is a common example, and we want to go over it. Our guiding question is exactly the same. We're looking at patterns of behavior and what can we do about it in terms of implementing PBIS systems and practices. When it comes to efficiency, the data, it's often very similar, where the staff will complete a paper behavior referral form. Graveyard staff will enter that into an Excel spreadsheet. And then the data analyst would then be responsible for taking that data and creating graphs that can be shared with the PBIS team regarding the frequency of the problem behaviors and trends and things like that. Obviously, it's relevant because we want to monitor and evaluate the trends in terms of type of problem behavior and frequency so that we can implement database decision making to improve our systems and our practices. Timeliness is where we see a difference between the use of Excel and Swiss in our experience. Typically, when you're utilizing Excel, there can be a 2 to 4 week delay before the analysis is available. Oftentimes, this depends on the skills of the data analyst in creating these graphs, as well as the time that's allocated for the data analyst to be able to do this. So this may be drastically different in your setting, because if you have a data analyst who's been allocated the time to create the graphs and has really good Excel skills, this could be decreased. It could be 24 to 48 hours. But if your data analyst has not been allocated that time, then the time is going to increase because there's a manual process that needs to go through to create the graphs. In terms of accuracy, it's exactly the same. We want to update those spreadsheets when individuals enter and exit facilities. We want to look at fluctuations in our population over time, and again, make sure that we're doing data integrity checks and providing staff training on how to complete the referrals and enter the data. So now we're going to show you just a couple examples of minor and major problem behavior that could be generated in Excel. This is an example of the frequency of physical aggression and verbal aggression over time. The orange data path represents verbal aggression and the blue represents physical aggression. So we can kind of look at, okay, what happened on those dates and what can we do to intervene? In the next graph, this is a bar graph, which indicates the frequency of problem behavior. You can see here that this lets us know that not following instructions is a high frequency problem behavior. That's the second bar in the graph. And so we would want to intervene and think like, okay, what skills can we teach? What reinforcement can we embed to decrease the probability of not following instructions and increase the probability of following instructions? And I think, yep, now we want you to think about that example that I just shared, and how would you score this example using Excel, utilizing the facility-wide TFI 1.13. Okay, we've got some 1.5s, which unfortunately they don't exist. A lot of people want to do 1.5. Lots of ones. Let me scroll through here. Yep, it looks like ones. And yes, when Kim and I scored this, we were in agreement that this was a 1 because we were basing it on our experience in terms of ready access. If, like I said, you have a data analyst who has time allocated for this task and they have great skills, it could easily be a 2. But that is really going to depend on the time and skills of the data analyst that you have at your facility. All right, Kim, I think I'm turning it over to you, and you are going to talk about positive acknowledgement.
Sure thing, yes. So we've been talking about the outcome data. Sherry's been giving examples about behavior referral data, and I'm going to dig into a couple other real life examples of outcome data that we found very useful to track and use as part of our decision making. At 4 of the sites where I'm the coach and behavior analyst now in Placer County, we use this online program called Live School. It's an online app for student recognition. It also has features for tracking negative behaviors as well, but we really use it mainly for tracking positive behaviors. It can be completely customized for your site. So every site, we look at what our PBIS values are, and then we look at what are the things that we really want to promote and encourage for our students. What are alternative behaviors for our students compared to problematic behaviors as well. And then we actually program in there what the specific behaviors are that we want to explicitly reinforce. And then staff can give points either on their iPad or their phone or their laptop or whatever. So one thing that I really like about this system is, because I'm a huge data nerd, is because it's got a lot of different data dashboards that you can drill down. You can look at patterns of recognition at the student level. You can look at it at the teacher roster level. You can look at it at the grade level. You can look at it per staff member. You can look at it school-wide. So I can get in there and see what are the trends as far as the frequency of students getting acknowledged or individuals getting acknowledged. This, by the way, also ties into our school stores. So they earn points, and then there's rewards that you program in there, and then you can just have the student purchase a reward if you have a school store, so on and so forth. But I use this a lot in consulting with programs at even a tier 1 level. So if they're saying, oh, we're having a problem with XYZ behavior, and that's showing up in the behavior discipline data, then we'll look at this data and say, well, how often are we actually acknowledging and reinforcing the pro-social behavior that we want to see instead? And we look at that too at the individual student level. So it really helps us to have action planning related to system-wide issues and problematic behavior as well. Whoops, I went the wrong way there. So I'll show you some examples. These are just screenshots I took from 3 of our alternative education programs, where all I did was grab the top 5 most reinforced behaviors across the program. You can see the categories of what's acknowledged are different per site. So some of them are really focusing a lot more on, so I think the one in the upper right is from a independent study-based program, alternative program that we have, so you can see keeping original appointments. That's obviously been a big issue there. So they chose that as something to reinforce. Some of the criteria relate to distance learning. We've had to adapt some of the things that we're reinforcing based off of everything that's going on now. But you'll see it peppered in with not only academic-based skills, but also values-based skills. Like I set a goal and stuck to it, or I was focusing, or I'm perseverance or being responsible, so on and so forth. So you can really drill down and get a lot of valuable information that isn't focusing just on problem behaviors. It's focusing on what's going well and using that for decision making. So that's another example of outcome data. And there is a link to information about Live School in the resources in the Google Drive as well. This is an example, so still talking about outcome data, talking about disaggregated data. This is an example where we kind of mashed together behavior referrals with recognition data. And this is kind of a trifecta here. The reason that I looked into this at one of our sites is based off of survey data. So the student survey data had said, when we disaggregated the student survey data, the response from our Latino students was lower about how often they felt that they were getting recognized by staff. So we said, okay, we need to look at these two types of data and get more information about that. So disaggregating our behavior referral data on the left-hand side, you could see our Latino students at that time accounted for 3/4 of the students who were getting the highest number of behavior referrals. That's an issue. If we hadn't disaggregated that, we wouldn't have known that that was a trend that was happening. And I looked at our live school data, the positive recognition point data. Our Latino students were only accounting for 8% of the most frequently acknowledged students. So there's, it obviously led to some really rich discussions that our staff took, and training and coaching and everything around cultural responsiveness. But we wouldn't have known this if we didn't disaggregate that. We didn't disaggregate our survey data, if we didn't disaggregate our behavior referral data, and if we also didn't disaggregate our student recognition data. So this is getting really deep into the weeds, but wanted to provide you with an example of how those three types of data can work together as well. Okay, so those are some examples about outcome data. Now we're going to switch to that second leg of the stool and give some examples about survey data. I want to mention PBIS assessment. There's a link there to the webpage about how that's available to everybody. There are various different survey tools that you can use when your school is set up there, your school or program is set up there. And I rely on it all the time. In our examples, we've also shared how you can do surveys, just setting up something on Google Forms, setting something up at that level too. So it doesn't have to be fancy, doesn't have to be through PBIS assessment, but if it's all already set up and there for us, and if it can graph the results over time, then that is a really good tool. So again, when we're talking about survey data, the big overarching question is, how are we measuring the satisfaction and perceptions of all of our stakeholders related to PBIS? So one example here, again, this is in the example document that you have, walking through an example of kind of a social validity survey. And this is an example from one of our local juvenile justice facilities. So basically setting up to make it efficient, just set up an anonymous survey in Google Forms, sent it out, and specific to, this was about how's the Swiss data system working for you. Relatively several months after rollout. When you set up a survey in Google Forms creates graphs of the responses. So there's no additional things there unless you want to kind of, so in the examples that I'll show you, I pulled out additional highlights as far as summarizing it and sharing it with the staff. So the relevancy for this, it lets us know if it's working, if a specific practice or system is working for the team. Sometimes that's the easiest way to find out if we're not getting fidelity with something, or if it's not working the way we want to, going to figure out, okay, what are the obstacles for the staff? And that allows us to have an easy fix. The timeliness, as I said, as soon as people put in their responses, it's graphed. And we can pull that immediately. As far as accuracy for surveys, I think across all of the programs that I support, I have to be a broken record with staff saying, I promise you that this is anonymous. That might just be, specific to the programs that I'm in, but as soon as they really are sure, and I'll show them, you can see, it's made anonymous. I think that's a really big part about accuracy. And then making sure that we have supervisor support, and that the supervisors are saying, yeah, I really want all of you to take this. So at least 80% of people are participating in it. So this is just an example of how for this particular Google form, some of the results were summarized and discussed at the PBIS meeting with the PBIS team. So saying, for example, the majority of staff find the behavior documentation form easy to use, 3 on a scale of 1 to 5 being, disagree, or strongly disagree to strongly agree. So summarizing that. The majority of staff say that it takes between either less than 1 minute there, or between 1 and 3 minutes. So the majority of staff are rating that it's a a relatively easy tool to use. The majority of staff are relatively confident. Remember, at this time, this was a pretty new system, but pretty confident about the use of the forms being consistent across staff. Okay, good. I'm feeling good when I see that when it's a relatively new system. And then this is one of the things that we talked about in the PBIS meeting. The question really, does the form capture information that helps the team make decisions about how to address behaviors in a facility? More than a quarter of the people said no, and more than a quarter of the people said, I don't know. So many staff were not sure how that data was being used. And that was a big red flag for the PBIS team. So we had a discussion about that data, and we made some action plans around, okay, how are we going to increase the transparency of data and the conversations about data and how data is used with the facility as a whole. And again, unless we had this survey and analyzed this data, we wouldn't have necessarily known that there were some action plans that we needed to take around that. So that was an example of a staff kind of validity survey. This is an example of some responses to a staff survey about school climate. So just pulling out some of the items, and this was the school climate survey for staff from PBIS assessment on PBIS apps. And you can see it automatically summarizes the mean score. Here, a score of 1 is strongly disagree, and a score of 4 is strongly agree. So looking at some of the strengths here, the items, the highest rated items were consistently reflecting positive perceptions of teamwork, safety, and equity. And then an example here of a student survey of school climate with some of the biggest jumps highlighted. So for example, this was from one of our community schools, I believe. And I highlighted the bars where we had seen the biggest growth since the last time we had students take the school climate survey. And so again, this can be used a lot of the times when I'm doing student school climate surveys. I then do focus groups with the students and talk about, hey, why do you think this was high? What's going well? What's specifically going on well with our PBIS program and our program to make you feel confident about this? And why do you think this score is a little bit lower? So these also are very informative as far as making action plans related to your PBIS program. A note here that we wanted to mention about the staff involvement item on the facility-wide TFI. It lists a variety of different activities that should be taking place. So providing the summaries of the rule violations and sharing those regularly, providing opportunities for staff to provide input on how everything is going with the core features of PBIS, and including staff as far as making suggestions. And so keep in mind that the scoring on this item, you have to look broadly at what's going on in your facility and identify, it might be 1 of 3 activities or 2 or all of them. So this one, you can't just take necessarily one thing that you're doing and rate the facility-wide TFI item related to that. You have to look at it as a whole. All right, I'm going to pass that off to Sherry.
All right, thank you, Kim. So I get to finish up with the third category that we've been talking about, which is fidelity. And someone had mentioned in the chat box earlier that it's, sometimes we tend to focus too much on the fidelity, the TFI, and looking at the fidelity of our implementation without doing specific fidelity checks on our practices. So both are important and both are valuable. So we can do the TFI walkthrough. We can look at specific tools to check fidelity of implementation practices, as well as just our overall tier 1 fidelity. And when we're talking about fidelity, we want to know, are our systems and practices being implemented as designed? It's very, very important. We can't assume that a lack of progress for the individuals in our settings is because they're not responding to the intervention or practices if those interventions are not being implemented correctly. So it's super, super important for us to do that, as well as measure our overall fidelity of our tier 1 implementation. So I'm going to share with you 2 examples of what we would look at when we're looking at fidelity. So this is an example of the facility-wide TFI results that could be monitored over 6 different time frames. So you can see there on the left, we're looking at our tier 1 implementation. It went up in that 5th time frame to over 90%, and then went down a little bit the 6th time we measured it. Tier 2, we have a great increase, similar results though, a little bump down when we look at that final assessment time frame, and then our tier 3 is steadily increasing. So this one looks at the overall implementation for all of the items within each of the tiers that we're assessing. In the next slide, we're going to look at the subscales that are available when we're assessing overall implementation in terms of, for tier 1, we're looking at teaming, we're looking at implementation, and we're looking at evaluation. So this might give us an answer about why in that final assessment timeframe, we had that slight decrease in tier 1, because something happened with our teams, because now we're below 80%, and something also happened with our evaluation. We can also use the items to action plan, as Kim had mentioned before, go into the item analysis and look at the very specific items on the TFI and action plan for things that are not scoring at the level of 2. The next thing that I want to spend some time on, and this is in the Google Drive, it's the last document listed. It's called the Supervision Check-in for PBIS Implementation Example. And this is what we're talking about when we're looking at the fidelity of individual practices that we're implementing. So this form would be used for a supervisor to observe a staff and note the setting and the date and the time. And then the first section there are specific questions that just have yes or no or not applicable answers. And we're looking at things like positive contact and active supervision and providing appropriate consequences. The second half of the middle part of the document then gets into a scale of 1, where it happened not at all, up to 5, which is consistently, and it gets into more specific questions. So is the officer teaching common area behavior rules or using pre-correction? Is situational awareness being maintained? Is the environment being scanned? Are they using a calm, controlled, and respectful tone and approach when correcting inappropriate behavior? Now, remember, prior to this fidelity check, there would be training that's put in place for the staff on all of these items. So we wouldn't want to just go in and observe if we haven't properly provided the training, the modeling, the practice, and the feedback that's necessary for our staff to acquire these skills. But then after that, these types of fidelity checks are very important. And I know at the bottom of the form, there was a section looking at the 4-to-1 ratio or 5-to-1 ratio, as many people mentioned, for positive to neutral or corrective statements. So these types of fidelity checks can be developed for each of your practices. This is something that Kim and I discussed that we do not see often enough, right? Everybody's doing the TFI, but they're not necessarily checking the fidelity of their individual practices. So we really want to encourage you to think about this in your work, in your alternative settings. Okay, Kim, this is time for the guided practice. We're on a good time frame here because this should take a few minutes, but I am going to start sharing my screen. And what I want to talk to you about with this guided practice is, like Kim said, we really want to put you in contact with this planning form so that you will actually use it. We don't want to provide you with an 1.5-hour webinar in something that's just going to like stay on your desktop or stay, if you print it out, put it in a file folder or whatever, and not use it. So we want you to actually practice this for your facility. And we're going to go through each step and give you a little bit of time, and hopefully this is gonna go just fine. So the first thing I've got to do is start sharing my screen. Okay, and you should see the Google Drive folder. It's cleaned up. It's funny with like 100 and whatever people here, people kept making copies and I was frantically removing them. So I'm sorry if your documents got removed, but they're here for you. This drive will continue to exist and you can always go down and download a copy. But what I want you to do right now is download a copy of this PBIS data and alternative settings planning document. So you can right click on that and you can download yourself a copy, or you can double click on that. So go ahead and do that right now. And then I'm gonna pull up my example that I'm gonna walk you through. I'm gonna give you just a few moments to make sure you have your document. So the model that we're going to do for you is outcome data. We're gonna look at an outcome data source, and we're gonna talk about utilizing, oh, I've gotta make this a little smaller so it doesn't go all crazy. Okay, we're gonna talk about utilizing check-in, check-out to monitor the outcome data for attendance and program participation. The guiding question that we want to ask ourselves is, are the majority of individuals participating on a regular basis in programming? All right. So what I'd like you to do now is, given your example, oh, and I'm sorry, I should have brought this to your attention. You can pick outcome data as the one that you're going to practice right now. But if you scroll down, you might decide you want to look at Fidelity data or survey data. So on your end, on your example, you can complete whichever one works for you. But I'm going to give you just a few moments to pick that outcome data, pick your data source, and then write your guiding question that's specific to you. And I'm going to ask people to put in the chat when they've done that, so I have an idea of when to move on to the next step.
So really for this one, Sherry, it's just that they're selecting if they're going to walk through an outcome survey or Fidelity, and all they're doing is on their downloaded document, typing in forming their guiding question.
Yep, and their data source.
Perfect.
That's it. Yep, that's the first step. So it should take you just a moment or so.
And there are examples of guiding questions on the example document if you want to see other examples and some prompts.
That's right. We hope on your end you're actually doing this. Of course, we have no idea if you are.
We decided to do this instead of putting everybody in breakout groups, so.
Okay. All right, April, thank you. She is ready for the next step. I appreciate that feedback.
April gets live school points.
All right, I am going to go with the next, with the first question here that I'm going to ask myself. So I've selected that I'm looking at check-in, check-out to answer my questions whether the individuals in my facility are participating on a regular basis. So I need to think about the efficiency of my data and how I'm going to collect it. So I know that I have, oops, that went into the chat box. I know that I have staff are completing paper check-in, check-out scoring forms. And just like some of our other documentation, graveyard staff are entering the data into a pre-programmed spreadsheet. And so everything's in Excel. Sorry, I don't want your suggestion. Okay, so everything's in Excel. And then the data analyst retrieves the graphs and presents it at the monthly team meeting. So that's the efficiency of my data. It's It's gathered by the staff on paper forms. Graveyard staff are entering it into a spreadsheet, and the data analyst is retrieving the graphs to present to the team at the monthly meeting. So please complete that step for efficiency. Renee, I will put the link to the Google Drive in the chat box for you, because you definitely want that or you can't do this activity. All right. Oh, Brenda already did it. Brenda, you're so fast. Okay. So take a moment to complete the information for your version of this in terms of efficiency. And if you want to let us know in the chat box when you're done, I will move on to the next step. It's funny, we do a lot of trainings in Nevada on Zoom, but we don't use webinar. So then people can give us the little, you know, emoji thumbs up, or they can give us a real thumbs up. So it's kind of odd to do this without seeing your faces. Thumbs up from Lisa, great. April again, thumbs up. Okay, so I'm going to move on to the next one. So why do we care? Why does this matter for us in terms of our program? And the thing is that check in, check out graphs, they allow the team to identify patterns across individuals, so proactive measures can be taken. We also use check and check out points in this example to determine privileges via a level system. So it kind of has a dual purpose. So now take a moment to put in there why this metric is important in terms of being relevant for your program. Let me know when you're ready. Oh, Selena put the actual emoji thumbs up in there. All right. In terms of timeliness, due to the pre-programmed nature of the graphs, instantaneous access to the data is available. However, we know that our spreadsheet doesn't allow us to analyze the data in terms of times of day or time periods. We only get one score for the whole day. And so it doesn't allow us to look at it in terms of time periods or expectations. So that's a drawback to it. Swiss has a check-in, check-out platform, but unfortunately they restrict it to a specific point spread. And for this example, we're collecting points, 4 points for each time period. And I think Swiss only allows for a 3-point spread. Do you remember that, Kim? Is it 3 point?
In the check and check out Swiss, yeah, it's either 0, 1, or 2. Yeah.
So and there's no modifications to that. Okay, so talk in your document, make some notations about how timely your access to data is using your example. give me a little feedback in the chat box when you're ready to move on. All right, thank you, Erica. All right, Katrina and April again. So finally, I want to ask myself, what additional calculations do I need for variability and enrollment, and how do we ensure reliable data? So again, we're going to update the spreadsheets as individuals enter and exit the program. We're going to do data integrity checks like always, and we're going to train our staff. So go ahead and fill up that last row in your table, and then we'll talk about scoring. Give me that feedback when you're done. Same routine. Okay, we're getting some responses. Thank you, April. Thank you, Janet. So we want to bring your attention to, for the planning form, we included all of the TFI items that you might use to measure these different types of outcome data. Obviously, this one here is not discipline data. So we're gonna kind of get rid of that. You're not gonna be using that. So I'll just gray that out. And it is also not about youth acknowledgement and feedback. So I'll just gray that out. The TFI item that this check-in, check-out data represents is the database decision making. Because obviously we're going to use our check-in, check-out information to make database decisions to assist our youth who are the individuals in our facility who might need more intensive programming, more reinforcement, different, more detailed check-in, check-outs with more frequent check-ins, whatever it might be. So how would we score this? I'm going to say that I think this one is a 2 because we're reviewing the data from the last month. We're making sure that it's used for database decision making, and we're going to use an action plan to develop or modify what we have in place. So this example, I'm going to say scores a 1, or I'm sorry, scores a 2. So that little walkthrough of this is just so that you can see how quickly and efficiently you can complete this planning form. I believe we started this 5 minutes ago, and that's all the time it took. And that's with me modeling and then you completing it. So we really want to encourage you to utilize this form, embed it into your work with your team within your facilities so that you can plan for effective use of data that not only answers these very important questions, but also considers fidelity of implementation using the facility-wide TFI. So I am going to turn this back over to Kim to wrap it up. And I appreciate you engaging with me during that activity. We hope you found it helpful, but we really didn't want you to just leave here without without contacting that planning form. So go forth, Kim.
Thank you so much for walking us through that, Sherry. Very much appreciate that. Okay, so really, before we jump into some kind of Q&A, talking about our recommended next steps with using these examples and these tools that we're suggesting to you. So consider using that data planning tool, or change it, do whatever you want with it, but kind of consider using that process that we just walked you through with your PBIS to either select a new type of data source, really have that discussion. Do we have the right outcome, fidelity, and survey data to fit our context? And if not, what do we need to add? And add one thing at a time and work on, or look at, if you already have those, ask yourself those questions about, efficiency and timeliness and accuracy, and see if there are ways to strengthen what you currently have. So think about, okay, do I have a PBIS meeting coming up or a leadership meeting coming up where I could have those conversations and potentially introduce them to this kind of planning process? The second next step, making sure in whatever program that you're serving, that database decision-making is a living, breathing part of your process. Every month, every time you meet, that you're looking at your data intentionally, and not just stopping there. Look at the data, go do the here's what, so what, now what cycle, and figure out if specific action plans need to be set up. Usually just set up one or two things so that you can know reasonably whether or not you'll know what had an impact if something did change or didn't change. So make sure that you have structures in place for data review. And there are a lot of great resources out there about database decision-making and team-initiated problem-solving process and all of that. And then the third piece to think about, we shared a little bit about this today, but thinking about communicating about data with your programs. So whether it's probation staff or whether it's school staff, anybody that's infused into your program, taking a look with the rest of your team at how frequently you are sharing data and making it meaningful for them. How accessible is your data? So some of the examples that we showed today, you'll see they're really just clear, or there might even be a sentence up above it that says, this is what this data means. So just make, if people have to work hard to understand data, they're going to disengage from it. So thinking about, how does that currently look in your program, and how could we potentially strengthen it or boost that? So those are our three recommendations as far as moving forward with the information from today. As I mentioned, everything's in the Google Drive that we talked about today, but here are the links to those, and then links to the juvenile justice section on pbis.org. That is the holy grail of information in this field, right? So you go there and check out everything they have, and then links to a couple of different articles as well. So that being said, I think we wanted to save about 15 minutes for Q&A, and we are right there. So Brenda, shall I pass that off to you?
Yes, thank you. That was fabulous information. I want to make one point. There were some questions about, and I've got some questions I'm going to share with you in a second, but there were some questions about cost of, for example, live school. And I know the programs that I work with would not be able to use live school because of the technology requirements in secure care and the limitations in secure care. So the point I want to make for everybody is those technologies, live school and Swiss, make the process of data collection a little easier. But it doesn't change all of the goals and the guiding questions and the purposes for data collection. For example, back using your example to use live school for recognition, Kim, in one of our secure care projects, this was a large facility, state level facility, we monitored the tokens that were given out for reinforcement purposes manually. We monitored them and disaggregated those data across multiple variables like time frame that they were given out or the activity that they were given out, staff members that were giving out the tokens, and for what kinds of behaviors. If the overnight staff, this was a residential facility, the overnight staff disaggregated or tallied all of those data, and those data became available then for the PBIS team for decision making. So it was not as efficient perhaps, but it was manageable, and it did provide data that allowed the PBIS team to make better informed decisions about their acknowledgement systems. So if our participants aren't able to access or get a subscription to Live School or Swiss or any other technology, that doesn't change the overall purposes. Okay,
Exactly.
so speaking of technology, we had some questions about accessing Swiss and cost. And Kim, would you like to talk a little bit about that?
Sure. Swiss is for every site account, it's $350 a year. And that's at cost to University of Oregon. It's set up with a Swiss facilitator who can help provide technical assistance and configure the system and all of that. So that's something, I believe the link in the slide, for the hyperlink to Swiss will take you to the page with all of that information, and you could contact them for assistance with that. So
Can I add to that, Kim, that when you think about $350 a year compared to the time that staff would need to manually analyze and create all those graphs, it really is a minimal cost when you look at it in that manner. So I know some places don't have the extra money to spend, but if you think about the time that will be saved for staff time, rather than doing calculations, I think it's a very worthwhile one. Yeah.
Mm-hmm. And I think I saw a question too about the cost for Live School. And that is, again, I love that you made that point, Brenda, that you don't have to have a paid program to monitor positive acknowledgements. That's just an example. Our little programs are so small. We have very few staff. So my boss says, yeah, I'll definitely pay for that because it works for us. But that's $100 per staff member per year to use the Live School program as well.
Brenda, I love your comment to Garrett about PBIS assessment adding this facility-wide TFI. Yes, please. We would love that. It would be so wonderful.
I sent a request about that this week, just FYI. So to PBIS assessment.
Okay, I'm trying to stay up with comments and questions. I'm also putting my partner's email address. Here's Jeff Sprague's email address. It's not on the slide, so there's how to contact Jeff. I want to give just a quick update. One of the things that we're working on through the center is identifying model demonstration projects. So I have developed a list of criteria, what we're looking for in model demonstration sites and alternative programs. And we have an application process that is ready to go. If you are working in alternative sites or with alternative sites that might be interested in showing off the good work that you're doing, send me an email and I'd be happy to chat with you about that. We've got some folks on the webinar today that are interested, and we've already started those conversations. So I'd be very happy to talk with you about that. And of course, one of the aspects of being a model site is using your data in ways that Kim and Sherry have talked about, and reviewing your data and using your data for action planning. Okay, let me check. There's been questions about, is this webinar going to be posted on the PBIS website? And the answer to that is yes. I don't know how long that will take, but I will submit it to be uploaded. Is anybody seeing any other questions that we need to address?
I'm loving how people are giving us ideas and telling us about these house points from Live School. Have you heard of that, Kim? It's
Yes.
new to, okay.
It's a feature that's in there, and it's part of the program and we've tried it. But yeah, it organizes the individuals into groups and they can have competitions.
Okay.
So,
all right.
Yeah.
And then Janet Christensen, we would love to collaborate with you. So I know you threw your email in there, but if you could please email us. I know Kim and I are having a great time in our collaboration in terms of database decision making. We're just really excited about all of this, all the work that we've been doing.
Definitely. I see a question here too about examples of effective rewards at the schools. It really depends on, the funding for our programs, but some of the things that we have are, at our community school, for example, students can purchase making things on the 3D printer, or, water bottles, school supplies. There's a bunch of different snacks. So, it might be hot chocolate or cup of noodles or Takis, so we kind of have a variety of things like that. At the facility, they are one of our local facilities. They have hygiene items, and they have extra phone passes, and some food-based items. We include sometimes things that students can purchase for one or more peers. So that's a good reward. If sometimes we work with individuals who, they're like, I don't really want anything for myself, but if they're very peer attention motivated, and they can buy something, or it might even be like, okay, I'm buying popcorn for everybody, and obviously those are higher ticket items. I did have a student ask me yesterday if he could use his points to buy school credits towards graduation. I said, absolutely not, but I thought that was very creative. So those are just off the top of my head, those are some of the rewards that we have. Sherry, do you want to jump in on some of the ones?
Very similar to the things that you mentioned. We also have things just like leisure activities, arts and crafts that can be purchased in the clothing items. Can also be something that are in the facilities that I work in. But if you don't have the funds for those kinds of things that cost money, remember privileges are always a great thing to add in, special privileges. So just like Kim mentioned, the extra phone passes, or maybe like late bedtime, things like that. So it doesn't always have to be something that costs a lot of money. Oh, Selena said they got a karaoke machine.
That's awesome. Oh yeah, being able to play music during breaks. Yeah, things like karaoke machines. That's a great idea.
Yeah, we've done also like special fast food takeout meals and things like that, like delivered. So there's lots of different things. Kim, did you see the Q&A? Those questions were when you were presenting and talking about Live School. Are you able to ask the Q&A questions?
The question is, in Live School, Kim, were you trying to capture every praise interaction?
Oh, no, that's a really good question. No, that would not be doable necessarily. We work with the team to identify what the core things are that we want to give points for, and whether they're value-based or replacement behaviors. And so really trying to get staff to capture those as much as possible, but there should be a zillion other positive comments throughout the day, and encouraging statements and connections that don't necessarily get captured in Live School. Some programs, so one that I was working with yesterday, for example, they decided that for 2 of the categories, and that's because they're still distance learning, signing in on time and then returning from breaks on time on video, that those would get captured every single time, because it's really tough for that program right now. They have a lot of stragglers. So that's an example where those things are captured every time, but they also have categories for going above and beyond, persevering, participating and being engaged in class. And those are intermittently recognized and given as recognition points. Well, that answers that.
Good.
Brenda, I see a second part of that question about comparing and contrasting live school with the PBIS rewards app. Do you know about the PBIS rewards app, Kim?
Is that the, are they talking about the no, I don't think I haven't used that. Yes.
Okay. Yeah, I don't have information on that either. So we can't answer that question, Brian, sorry.
That'll be Brian's assignment to do that research and get back to us.
I think they're talking about the new downloadable app, the Be Positive app.
There's another one, Brenda. I actually know of a couple school sites here in Nevada that use the PBIS rewards app, but I don't know the details of it. So they're two different things. Yeah.
Okay.
But I will look into it.
All righty. Well, Kim and Sherry, your presentation is so outstanding. You guys did such a nice job of not only talking about data and how it's important and how to use it, but then translating that into action planning and giving us some supports and prompts for doing that. The webinar will be recorded and uploaded to pbis.org. If you have any questions, everybody, just email Kim or Sherry or myself or Jeff, and we will be happy to respond to your questions or give you guidance or listen to the good things that you're doing. So thank you, everybody, for the hard work that you do every day and the important work that you do every day. We really appreciate it. Okay, thanks, everybody.
Thank you all.
Thank you.